Hi, this is Morgan Butler making my initial post for the self-video for the pain management teaching for the patient in the simulation. So there's a lot of information that is kind of necessary to better tailor care for the patient. In that video, did she have a vaginal birth? Did she have a C-section? What other things are going on with her after the birth? But in general, there are several things that can be done for pain management postpartum. So over-the-counter medications like ibuprofen, Tylenol, those can be used. If this patient has a problem with narcotic pain medications in the past, she might need something different. This is something that should be discussed with the doctor. You can also talk to the patient about other methods to relieve pain. So things like using ice packs on areas that hurt. Again, whether she had a vaginal delivery or a C-section, that kind of makes a difference. If she's having pain in the perineum, something like sitting on a pillow or a padded ring might be helpful. And then use of recommended pain medications and or stool softeners. So some of the common postpartum medications that are used to help with pain, something like Toradol, which is an NSAID like ibuprofen, use of things like Vicodin or Percocet as needed, again up to the doctor depending on what's going on with the patient. Use of ibuprofen or Tylenol. It kind of depends on what works for the patient. So the patient in the video complained that the ibuprofen upset her stomach. That may have been because she took it on an empty stomach. You could try it again with food. If it still continues to cause those problems, we might want to move on and try something else like Toradol or Tylenol or something of that nature. Use of things like Zofran and stool softeners are also important to help control some of those symptoms after birth. Other things that might be helpful, making sure that the patient understands to eat foods that are high in fiber, like fruits, vegetables, whole grains, and the patient needs to drink plenty of water, especially if the patient is planning on breastfeeding. Speaking of which, proper teaching for breastfeeding is very important. That can also cause some pain that could be relieved without pain medication. So proper teaching on breastfeeding and pumping, especially if mom is going to use narcotic pain medications, because you don't want those medications to transfer over to the breast milk, so stuff like that needs to be considered when discussing what pain medicines to take or switch to. Using things like cold washcloths or ice packs on the breasts may also be helpful. If mom is not planning on breastfeeding, then she needs to wear a firm, supportive bra to help stop production of milk and engorgement. So all of these things are important to consider for pain management. It's also important to explain to the patient that pain will not be completely gone. That's kind of an unrealistic expectation. You just gave birth, you're going to have pain, you're going to be sore, things are going to be weird and not normal. But you do want to highlight things that are cause for concern. So any areas that are hot, swollen, anything that's getting increasingly painful and not getting better, or any sort of weird discharge. You want to make sure that the patient knows that those are important, but the patient will probably have some pain and soreness. Those are things to consider. So related to this patient that's in the simulation, there's mention that she had a problem with drug use in the past. So postpartum pain control is very important, and if the pain of the patient is not controlled, it can, lead the way for adverse outcomes for mom and baby. So something that's important to consider is, for example, women who are on methadone during pregnancy, before pregnancy, whatever the case may be, had increased pain after birth and required up to 70% more oxycodone equivalents after a C-section. So that's a huge number. That's really important to consider. So depending on what was going on with that patient, I don't know what her drug use problem was. So that would be something that you need to kind of dig into, get more information about, discuss those different types of pain management, things that can be done with the patient, non-medication related, and then, kind of discussing with the doctor what medication would be appropriate for her. And it's important to remind her that she needs to see her OBGYN. They need to manage her care, and the use of her pain medications, because one person needs to be keeping an eye on that, not multiple doctors. So that's important to highlight as well. And then, always good teaching for caring for the baby as well.